AIDS.gov is at the 2014 Conference on Retroviruses and Opportunistic Infections, or CROI, in Boston, Massachusetts. We sat down with Dr. Carl Dieffenbach from the National Institutes of Health to discuss highlights from the conference.
Hello, I'm Miguel Gomez with AIDS.gov. I'm reporting from CROI and I'm talking to a federal colleague, Dr. Carl Dieffenbach from NIH. We've just finished the second day of CROI. And sir, could you share some highlights on the research that's been presented so far?
So today focused in part on two very important co-infections associated with HIV. One is hepatitis C, and the second is a human papillomavirus infection. The work on hepatitis C is nothing short of astounding. We've taken a chronic disease that affects millions and millions of people, not just in the United States, around the globe, and have developed therapies that literally can eliminate the virus from the human body within 12 to 24 weeks. If we could do that with HIV, we will really be able to do something truly amazing. Hepatitis is different in many ways. They're both from HIV, but the fundamental difference is that HIV becomes part of our genome. It becomes integrated, whereas hepatitis C does not. The progress on the papillomavirus was new vaccines. And as the major cause of cervical cancer and other forms of cancer, being able to vaccinate against a cancer is nothing short of spectacular. The other interesting set of research dealt with something called the Continuum of Care. The Continuum of Care is from the point of a population of who in a general population is HIV positive, but how do we take those people and identify who is positive? How do we link them into care, sustain them in care, get them to initiate antiretroviral therapy, get them to adhere to antiretroviral therapy, and then stay on it, really truly adhere. Because ultimately what we saw today was the true strength of adherence on antiretroviral therapy and the true power that has in terms of promoting health and preventing transmission. The other really interesting thing that's emerging from this meeting is not just a continuum of care for who's HIV positive, but the need and the true need for a continuum of care for who is at HIV risk. And we saw that today in two ways. We saw that there's tremendous challenges and opportunity with PrEP. PrEP is fantastic when it works, but you have to take the pills. And we are beginning to understand the motivation behind why some people will take their pills and other people won't take their medication. But one of the interesting breakthroughs or potential breakthroughs that was also presented today was some very long-acting drugs that when injected into the body could last for 3 months or longer and prevent infection. Long-term, that has benefit not just for the continuum of prevention care, but the general continuum of care, because essentially it will improve and ease the burden of adherence.
Absolutely. Sir, that was rather comprehensive. You covered major conversations that took place today. I'm actually going to tap you later this week as CROI comes to a close and we continue to have our conversation about the research and ask you more questions. I want to thank you for your time today. This is Miguel Gomez from AIDS.gov. Thank you.
For more information on the conference, visit CROI2014.org. And for more information about federal HIV programs, visit AIDS.gov.